A lot of times, as you know, patients will talk about having their breasts lifted after they've had breast augmentation. So they'll come in with implants that are, or breasts that are not symmetrical. One breast will be larger looking, or maybe firmer, or maybe higher on their chest, or in their areolas may be different in terms of size and position. And I personally, as you may remember, find that probably to be the most challenging circumstance to fix. Because in those instances, we find that we have to remove implants that may be giving them some trouble.
Right.
And we have to correct the breast environment or home environment for a new implant if we're going to put another implant in there, which we frequently will do. And then we have to somehow subtract the skin from each breast in such a way that we end up with two breasts that look the same. So that probably is the most challenging scenario when it comes to doing a breast lift that I've had to face. But it's a situation that I think can be managed primarily because of how we have developed a system of measuring and mapping out what the surgical procedure will be. That wasn't a situation with you, but it is a situation that is occurring more and more. Breast lifts are probably one of my favorite things or surgical procedures to actually perform.
Mine too.
Yeah.
I enjoy doing them.
Yeah.
And seeing the results afterwards.
First of all, there's a lot of women that need it. You know,
Yes.
this is not a breast lift is not a procedure that's necessarily confined to an older population. You don't have to be a granny to have granny-looking breasts.
I mean,
unfortunately,
I'm not.
And you know, I mean, saggy breasts can be a purely developmental thing. They can be as a result of having babies. Or it could be as a result of weight gain and loss and this sort of thing. So there's a lot of reasons why women might have breasts that are in fact saggy.